We are live, Nina.
Okay. Welcome to Health Webinar hosted by South Lake Foundation. This webinar is about all questions and answers that the whole community has. And we have an amazing panel here. Dr. Vinny Taneja, who is the Health Director in Tarrant County. And we have Benson Checo, who's the President of the Methodist South Lake Center. And then we have Dr. Jagdishwar Reddy, who is the Pulmonary and Critical Care Specialist. So thank you so much for being here. And before we start on the questions that we have from our community, I just want to state a few ground rules. Please send in your questions, audience, please send in your questions in the chat box, and they will be read out to the panelists in the order we receive them. And this is for the panelists. In case you're not speaking, please do mute yourself because this is a recording session and it will benefit our community if they have missed this session. I want to do a round robin to just give a few minutes for each panelist to share a few words before we start the Q&A session. I want to start with Benson. Benson, please say a few words you would like to say overall for a community here.
Absolutely. Good morning, everyone. My name is Benson Chaco. I'm the hospital president for Methodist South Lake Medical Center. I recently joined the team there 2 months ago in mid-November, so I'm excited to join the hospital and serve the community. Methodist South Lake is South Lake's only acute care full-service hospital, so we are here to meet your needs. We're in unprecedented times. I've been in healthcare for about 20 years now, and the last 2 years have been challenging for all of our physicians, our staff, everyone on the team, and it takes the entire team to care for all of our patients. Appreciate everyone doing their parts as we're going through this latest surge, and I've probably lost count on what surge this is, but the experts will definitely let us know. What we're seeing in our hospitals throughout our Methodist health system and throughout DFW, the volumes are increasing, and our staff are doing the best that they can. And what's challenging this time around is we're seeing a lot of our staff going out because of getting the illness. And so we just ask that everybody continue to do their part. The hospitals are here for when you've got the symptoms and you're needing care. We're definitely here for you. But we do ask that, please don't use the emergency rooms for a test because the emergency rooms are getting filled up. And while we're here to talk about COVID, the other kinds of healthcare issues continue. Heart attacks continue, strokes continue. And so please let our community use the emergency room properly for the right services. And so if you're asymptomatic or if you've got the sniffles or you're something in your throat, this doesn't feel right, you're definitely not the one that needs to come to the ER. When your symptoms get worse, absolutely, please come to us and we can take care of you. But my plea is that we don't overrun the ERs because all the health systems are challenged right now, and with supplies being tight, we need to make sure that we have the testing materials for those that need it the most. And so thank you all for allowing me to join you all.
Thank you, Benson. And the biggest takeaway I get from your whatever you have just shared is do not use the hospitals as testing centers. And if you have cough and cold, please do not use hospitals for that. Thank you very much, Benson. And over to you, Dr. Jagdishwar Reddy. We would like to get some insights from your side of the world. You're muted, Dr. Reddy.
Sorry.
Thank you.
Yes, hi. I'm a pulmonary and critical care physician. So I deal with lungs and intensive care most of the time. Again, I cannot reiterate, I don't think there are many people out there that are not vaccinated, but the best way I think is still, vaccination, masking yourself and distancing yourself and avoiding gatherings. So that's still, I think, the the way to get through this. Yeah, and I'll be happy to answer any questions that come through. And thanks for having me.
Thank you, Dr. Reddy. And what I would like to take away from what you just said is mask up. People, please do mask up as much as possible. And over to you, Dr. Taneja, please share some few insights from your world.
Sure. Well, I'm Vinny Taneja. I'm the Director of Public Health for Tarrant County, and thanks for having me again. And I want to echo the messages that our colleagues have just shared. The biggest one being, please, if you're not seriously ill, do not rush to the ER, because they're getting full and critical care is suffering. People have accidents, they have heart attacks, gunshots. I mean, you know, we're in a metro area, stuff happens. So let's avoid the ER unless you're absolutely seriously critically ill, life-threatening, right? Where you can't breathe, of course, go to the ER. You got a heart attack, go to the ER. But if you need a test, I will show you on a map. There's over 100 testing sites in Tarrant County alone. And in the metro area, there's probably like 250. So let's utilize those. They're literally every corner. There's these stock in a box that pop up at every corner when testing demand is up. So let's go there and get your test done. And if you're positive, go home and quarantine and you'll be okay. If you're seriously ill, that's when you go to the hospital. And then again, all the public health messages Dr. Reddy just shared, we'll talk about those when the time comes. But thank you again for having me.
Thank you, Dr. Taneja. And so now we would like to go ahead and start our question and answer sessions. So the first question I have for Benson, like I wanted to know what the current situation is in the hospitals. What are the patient profiles? And if you can quantify, like, you know, a rough quantification of like patients you'll see on a day-to-day basis and how it has changed from COVID-19 Delta variant to the new variant that we have right now, and we're struggling, and the main issue right now, what we have.
Absolutely. Yes. So this time around, we really saw the increase right before Christmas. So about December 23rd is when the hospital started seeing the, from a Methodist health system standpoint, our numbers increasing. We've probably tripled in the number of COVID cases that we have since then. It's still not as large as far as the first or second wave that we had, but it's definitely we've seen that increase. We're seeing an increase in the number of what we call PUIs, persons under investigation until a test is back. We're seeing that increase. And we're also seeing folks that are coming in with other issues and didn't realize they had COVID. And so we're seeing that this time around, whereas previously in previous stints, the push was COVID coming into the hospital, but now we're seeing people, they don't realize they have COVID. From a hospital standpoint, you know, the health system definitely feels vaccinations are the answer, right, to reduce it, to reduce the acuity. I personally got COVID right after Thanksgiving. I was vaccinated, I was boosted, and I joked with my wife that she brought something extra to Thanksgiving and gave it to the family. But my kids, they got it. I've got a 10-year-old and a 6-year-old. They were resilient. They were asymptomatic. But the two of us felt it. And I'm not sure if it was a Delta or if it was Omicron, but it was before, right after Thanksgiving. So it probably was Delta. And we had the shortness of breath, but nothing to the point where we had to go to the hospital. We followed our Methodist CDC policies of quarantining for 10 days and had a lot of good family time together for 10 days. But after that, we came out fine. And so absolutely, vaccinations, while it won't prevent you from getting the disease, it definitely improves your outcome drastically. This time around, we're also seeing while our ICUs are not getting filled up like we did the first or second time around, it's milder. We're seeing what we call the medical beds, the lower acuity beds, those are filling up. And we're seeing that throughout our system. And then, as I mentioned before, when our staff are getting it, our staff have to go home, that also impacts how many patients we can take care of. And so it's just a matter of, like Dr. Reddy mentioned, masks, vaccines, hand hygiene, staying away from folks. You know, if you get it, quarantine, stay. Don't go out anywhere. And if you need emergency attention, absolutely go to the hospitals, call 911, do what you need to do. But if it's a mild case, and right now it's tough this time of year with the weather changing, is it allergies, is it sinuses? I think all of our family friends that we know, probably about 70% of them have gotten COVID here in these last few weeks, and because of it's so mild.
Thank you, Benson. Dr. Reddy, I have a question for you. Can you tell me how the symptoms have changed over a period of time? Like, what did you see, like a transition that happened, like the previous variants to the current variant that we have, Omicron? Like, what did you see a change in that, or like, what was it?
Yeah, so, still the, amount of people that get exposed, that get no symptoms or mild symptoms is still, greater than, 90%. Most of them do not need to end up in a hospital, and, these are the people that have cough. Now, in terms of the change in symptoms with the Omicron variant, we're seeing more upper respiratory symptoms like stuffy nose, a little bit of cough, but like nose congestion and nose drainage, feeling like you have a cold. More than, in the beginning, it was more a cough, not much of a cold symptoms, but more of a cough and fever. Even with the Omicron, you have fever, but generally, people that have been vaccinated and have mild symptoms, this fever is, less than 3 days. Initially, the fever used to last for like 7 days, 10 days, duration. So definitely the severity and duration of symptoms have come down. But again, is that because you are immunized and you're protected and you're mounting a immune response much faster and being able to, tackle the virus, more efficiently? I think it's a factor of that. Now, people that are not vaccinated, obviously, they, get more sicker. They are having trouble breathing, and still ending up in the ICU and all those things. But if you're vaccinated and you don't have immunocompromised status, most of the time, people that are vaccinated, even if they have one medical condition such as diabetes only or high blood pressure only, they are doing fairly well. They are recovering within 5 days. Unless you have a severely what we call immunosuppressed state, such as you are an organ transplant patient or you're a cancer patient, those kind of patients, they have a more protracted course. And one more thing, initially I remember, everybody going and, or, just kind of the weird thing that happened where, people were buying up a lot of, bath tissue. In the beginning, I would say probably about 5 to 10% of people had diarrhea, watery diarrhea. And in duration, diarrhea was not a predominant symptom. With the Omicron, we are seeing some people have diarrhea, but it is still, about 5 to 10%. So I would still not panic and, go, stock up on a bunch of bath tissue or anything like that. But that is one other slight difference that I've seen. And in hospitalized patients, we are seeing a lot of what we call low sodium levels. That is another new thing that we've been seeing as well. Just the pattern in symptom change. Yes, that's the overall summary. Thank you.
Thank you, Dr. Reddy. Your insights were really valuable here. Like how you mentioned, right? I have a son who's a junior at Carroll Senior High, and every time he gets cough or slight change in his health or something, I do the testing. That bad it is right now, because we are very much scared. And that leads us to the second question I have, Dr. Taneja. Can you tell us what is the eligibility criteria for testing? Because we don't want to be testing our kids every small change or a cough or a sniffle or a sneeze or something like that, right? So what are thoughts on that, and what is CDC's guidance on that?
Yes, so that's a good question. Generally, for healthy folks, we do not recommend, and I termed this on TV the other day, freak out testing, because a lot of us are doing that. I sneeze, so we go freak out and get a test done. Let's not do that. You got to have some kind of a trigger. If you're in the workforce, like in the healthcare, you're constantly exposed. Okay, if you're having symptoms, please go get tested. But if you have a known exposure, somebody at your workplace or at your school tested positive, and then you got to think about it. Did I spend more than 15 minutes with that person without a mask on? So close proximity and then prolonged exposure. And then if you're developing symptoms, of course, you got to think about maybe I got COVID because that person had COVID. It's not necessarily true, but that's one likelihood that will occur. And then the other thing is that if you don't get symptoms, we still recommend that wait about 5 days and then get tested so that we know whether you were starting to develop it and we're just asymptomatic. And that is the most appropriate use and the most appropriate timing. First day of developing of symptoms or waiting 5 days after a known exposure. Freak out testing is just putting a lot of pressure on testing resources, and people are running out. Stores are out of rapid tests, other places are running out of tests, and people who really need it can't find it.
Thank you, Dr. Taneja. And one of the biggest questions that everyone has it on their mind, like home test kits and the shortage of it. So this is an open question to our panelists, like if anyone wants to give more, thoughts on this, like, are they reliable? First thing is that. And second thing, what can we do? Should we stock up them or what are thoughts?
Yeah, so let me take that because I get that question all day, every day, okay? So general rule of thumb for rapid tests, that your community must have a high outbreak of whatever illness you're testing with a rapid test. And then the person should be showing frank symptoms. That's when they're really highly accurate, almost like 98, 99% accuracy. And we always trust the positive coming out of it. Negatives we take it with a grain of salt because they are rapid. They tend to miss things a little bit more than the full test. So in terms of all those conditions being met, you got to think about it. We got a high backdrop of COVID outbreak in our community. And if the person's symptomatic, within the first 7 days of those symptoms, those tests are going to give you really accurate results. Problem is they're in short supply because right before Christmas break, everybody just bought up. I went to the store to pick up some medication and they're like, Vinny, what's happening? Everybody's buying rapid tests. I was like, they're just preparing for Christmas get-togethers. And it really wiped out the supply locally. And then nationally, there was a shortage because the federal government was buying a lot of supply from manufacturers to launch their rapid testing program, which should be coming here within a week or two. They're supposed to launch a national website where you can order your test at home if you're having symptoms. You still need a doctor's note to do that. More details will come because they'll roll it out. And then the other thing they're doing is they're sending supply to federally qualified health centers so they could take care of their patients who need a rapid test. And they will work with community partners like us to further distribute it into the community.
Thank you, Dr. Taneja. My next question is for Benson. I wanted to, and this is a tough but an honest question and answer that I would request. What is the recovery versus death ratios currently in the hospital that you have seen, and how it has changed from last year to now?
I'll be honest, I haven't looked at when this surge, it's still too early because it just came up. I don't have those stats as far as the deaths versus recovery. I know what we do know is the vaccinations, as Dr. Reddy mentioned, is if you're vaccinated, you have a much higher chance of recovery and leaving the hospital. If you're unvaccinated, it's one of those things where I've heard stories across the country and even here in the city where people are unvaccinated, they're about to get intubated and said, please give me the vaccine now. It's like, it's too late. And so I think the best way to know is that if you're vaccinated, and as Dr. Reddy mentioned, if you don't have underlying health conditions, you're likely going to be okay. If you aren't vaccinated and you do have underlying health conditions, I'm a man of faith, and prayer does a lot of things. But it's one of those things where I can't give you a percentage chance of recovery. And I believe in our community, most of us, believe in the medical science, and we're vaccinated. And I would hope that, I think there's 48 individuals on here that most everyone here is vaccinated. What I do know is that when we look at our admissions, 90% of them are unvaccinated. 10%, as Dr. Reddy mentioned, have the underlying health conditions and things like that. So I say it that way just to put some calm and peace in everyone's heart and minds, knowing that if you're vaccinated, you're likely going to be okay. If you're not, everybody has their choice, and I'm not pushing for vaccine mandates or nothing like that. Everybody's got their choice. We're all adults, and we make the right decisions for our families. As for me and my family, we all got vaccinated, and my kids, when they got that chance, this is new, right? So this has been around for 2 years. There's a lot we don't know. There's a lot we don't know as far as long-term impacts. And so I made that decision for myself, and my wife made the decision, and we prayed about it and talked about what we're going to do for our kids, and we made that decision. And so that's the best piece of advice I can give you all. And as far as metrics, is 90% of those that are in the hospital are unvaccinated.
That is very much, it's a very interesting, like how unvaccinated folks are more at risk. So South Lake community, get yourself vaccinated, get boosted up, and mask is important, and reduce gatherings. These are the things that we need to take care of. Thank you, Benson. And Dr. Reddy, I have a question for you. When it comes to patient care and treatment, we don't want to come up and end up in hospitals. What can precautions or care we can take at home, other than the things that I've mentioned, vaccination, masking, anything else that we have to steam ourselves, or the diet or food, or anything that you would advise?
Yes, I will start off with the previous question that you were asking about, death rate. I'll add to what Benson said that, typically what happens is there's usually an event like Christmas, New Year, a lot of people gather. And in the past, we used to have a surge about 2 weeks later. This time it was much faster. The surge came within a week. And how long the surge is going to continue, I cannot predict that. But the sickest of the sickest, that end up in the hospital and ICUs, most of them are in the hospital from anywhere from 1 week to a month. And that's when after you start seeing deaths. So I would say you would have a better estimate of the death rate probably by the end of February. Mid-February or end of February, you'll know better, what's the death rate with this surge that happened, or with Omicron. And now, with regard to your, this question, in terms of what treatments you can do at home if you have mild to moderate symptoms, again, going back to, monitoring your temperature, monitoring your oxygen levels, and if you have diabetes and things like that, make sure, your blood glucose is, under control. And if you are confirmed positive, just take off from work and get adequate rest, and, regular eat healthy, fresh fruits and, vegetables and all those things. But, rest also plays a role. Now, if, again, ideally, if we had enough supply, I would say if you're positive, you can go and get either the Paxlovid, the newer antiviral medication, or the monoclonal antibody treatment. But right now there's a huge shortage. So if you don't have any other underlying medical conditions, they're recommending that you wait. No need to go get yourself Paxlovid or the new what is it called, monoclonal antibody or MAB treatment. It's called sotrovimab. Again, these keep coming up every month. There's a new medication now. In the beginning, remember, it was BAM. And then after that, it was Regencov, and now it's the sotrovimab. So that is typically reserved for people that have, at least moderate disease and have underlying condition, or mild disease but have risk factors. Now, the same old thing, proning yourself at home, checking your oxygen level, and you can do the steaming. That helps, relieve some of the mucus and congestion and helps you breathe easier. But one thing I would recommend against is adding any kind of, Vicks vapor rub or any kind of oils into the hot water, because essentially it's a chemical that, you have oil vapors and you're inhaling, oil vapors. So that is not good when it goes deep into your lung. Vicks vapor rub is only, supposed to be applied, externally. So don't add these Vicks vapor rubs or other oils into boiling water and inhale those oily steam, because that can cause a different problem in the lungs. That is in general, and again, just kind of the usual thing. Make sure somebody's checking on you, and if you're getting worse, go to the doctor or emergency room or urgent care, whichever you think appropriate. Yeah.
Thank you, Dr. Reddy. And that is one of the most common thing that we do. Everyone, I think, if like you're an Indian, you would definitely do that, like putting Vicks vapor up in steaming water and then steaming it. That's how we were trained to feel that that's the main thing, you ease up your nasal passages. But thank you for letting us know that's not the right way. Again, South Lake community, please make sure you do not do this. And when you steam, do it with some filtered water or distilled water, and do not add any essential oils or Vicks vapor up to that. And one of the facts that you mentioned, and that leads us to the next question to Dr. Taneja, you said that the Christmas holidays, you thought that it would peak after 2 weeks, but it didn't happen, and the surge was instant. Now, Dr. Taneja, can you tell us, do you think the worst is yet to come, or how the forecast looks, and do you see the curve anytime flattening, or are there some something in the near future that you can share some insights on that?
Absolutely. I know we get that question a lot. It's unfortunately very hard to predict because there's so many variables. But generally what we've seen with other waves that have happened, the Delta and the Beta before that and several others, typical surges last 2 to 3 months. And the peak is usually somewhere in the middle, right about at 6 weeks from the start of the surge. Now this one, as Dr. Reddy said, is a very fast moving one. It escalates really fast because the Omicron variant is highly infectious and the incubation period is shorter. Normally for COVID, it's 2 to 14 days, but in this case, we're finding people getting symptomatic in 2 to 3 days. So it is a faster moving outbreak, so to speak. So you can extend that saying, well, if it's faster moving, it should peak faster and likely be on the other side of the curve sooner. And there are some modeling data out there. UT Southwestern has done some modeling. They're starting to project that we'll have a very rough January, but likely by the end of January, we should be hopefully on the other side of the curve on a downward decline. It won't end, but we might start to see some decline in caseloads and all this type of things. And the things that keep it going, right? I mean, why do you think it's going to be rough in January? Well, one, we had a holiday break and people mingled, and now we've got an explosive outbreak. But then schools are just opening this week and colleges are opening next week. So more and more people are going to come back into normal routines, and it's going to add some fuel to that surge there. So that's why we're expecting that January is going to stay quite heavy, and then hopefully by the end of January starts to sort of cool off a little bit.
Thank you, Taneja. So we are still waiting to see how the data looks like in the next few weeks. The next question for you, Benson, is we heard about when we should not go to hospitals and when we should not get ourselves tested, but I wanted to know when we should come to a hospital, what are the symptoms that that we need to see and evaluate and then visit hospitals.
I'm going to defer that to Dr. Reddy, physicians on the call. I think they're probably best to talk about what kind of symptoms. We'll take care of you, right? So if you come to us, we'll definitely want to. But I think from a clinical standpoint, it's best serving this community if it comes from one of the physicians. So I'll default to you, Dr. Reddy.
Yeah, so one of the things is breathing problems. If you're having trouble breathing, yes, you need to either call 911 or get quickly evaluated. Depending on the severity, it could be urgent care, it could be emergency room, or it could sometimes even be your physician, your primary physician, if you're having very mild, difficulty breathing. And one of the things that's going to also guide you is your oximetry or the oxygen saturation level. So if it is above 93%, you don't have to worry. But if it is below 93%, you need to get seen by a physician, depending on how short of breath you are. And the other things as well, you can have fever that is not very worrisome. You can take Tylenol, but be careful with the Paxlovid because there's a lot of medication interactions that they're coming out with, because it's a very new medication that's just been released in the last 2 months, and we're learning as we go. And it's metabolized through the liver, and Tylenol is also metabolized through the liver. So you got to be careful, no alcohol and all those things. Now when to call somebody or go to the hospital if overall you're not feeling well, because sometimes what can happen is when you're sick, your diabetes could get out of control or your blood pressure can get out of control. So just use common sense in terms of you're just not feeling very well. Either your blood pressure has changed, fluctuated from what it used to be. But one of the main, two things is your oxygen levels and how your breathing is. Those are the two main things. Some people we've also been seeing are having a lot of diarrhea. If you're having diarrhea and you feel like you're getting dehydrated and feeling weak, yes, that would also be another reason to get checked out in the emergency room. Yes.
Yeah, can I add some?
Go ahead.
Especially for our Indian community, because we tend to source a lot of our medication back from India and do home treatments. A lot of folks start on courses of antibiotics and high-dose steroids when they have, cough, cold symptoms and all those type of things. And Dr. Reddy has brought up the issue of diabetes and blood sugar control. Those steroids are going to mess with your sugars big time. So unless a physician is recommending that you do this, and then you have the right instructions to take care of all of that at home, please try not to do those heavy medications, because COVID is a complicated illness. It messes with a lot of things. And then, of course, a lot of us living here have blood sugar issues, heart issues, all those type of things due to the diet and the lifestyle that we follow. So be extra careful, just be very vigilant. And then when these things get out of whack, that's when you go seek medical care.
Thank you very much. That was helpful. And this is a question from one of our audience, how concerned should we be about flurona? And this is a common question across the board. Anyone can answer that. And how is CDC also quantifying it, or are there any preps going on for that? Are the symptoms different from what we have the current variant? Can anyone throw any insights on that?
Yeah, so that's a media coined term. Unfortunately, there's really not a separate illness called flurona. It's just that the same person has the flu and COVID at the same time, which can happen. You can have two illnesses at the same time. They're both respiratory illnesses. Currently, it is flu season, and we're in heavy flu season this year compared to last year when everybody was wearing a mask and flu is almost not there. So yes, we've had cases where both flu and COVID have been found in the same person. Symptoms are similar to each other. Flu and COVID don't really show much of a difference in terms of symptomology. So the tests are there. A lot of these large-scale drive-through testing sites typically don't have that because they're only funded for one test to do the COVID. But if you go to an urgent care or your physician's office is working with you to get a test done, you can actually get a panel. So they'll do a flu test, a COVID test, an RSV test, and sometimes they put on a full respiratory panel to see what you have. So that's when you find out that you've got more than one illness. And another thing, a lot of people, like I said, try to do COVID tests 2 or 3 times. They do a rapid test at home, turns out negative. So they go to a drive-through site, get a PCR a couple of days later, turns out negative, and they still keep coming back to get a COVID test. Well, no, that's the time to go look for other illnesses, go get a flu test done and other things, evaluate properly. Don't think it is just COVID because other illnesses are circulating in the community as well.
Thank you, Dr. Taneja. And this is to Benson and Dr. Reddy, what extreme scenarios are we seeing in kids without vaccination, in hospitals and as patients, what do you all see, and what are the scenarios and what are the symptoms you all see?
So at Methodist Southlake, we don't have a pediatric floor. And so we're not seeing many pediatric patients coming to the hospital. We're seeing more adults. I'm not sure if Dr. Reddy in the organization he's in, if y'all are seeing peds. I can only speak from, I just mentioned my kids having it. They were very mild. They were in between their vaccinations when they got the corona.
Yeah, sorry, I'm also an adult, physician, and Baylor Grapevine, where I primarily work at, is also not a pediatric hospital. But I wonder if in our audience itself, there may be some pediatric physicians because there's a lot of physicians in Southlake just in average. So I wonder if anybody is a pediatric physician.
Yeah, and let me add something. So as the health department, we do track a lot of that data. So we have surveillance information. There are kids hospitalized in Tarrant County, especially at Cook Children's, because that's our main children's hospital. And the pandemic peak was last year, about 44 kids in the hospital. It may sound really low, but that's a very high number with one illness in a pediatric population to be hospitalized, because many kids were sick. Generally, they're very resilient and they're taken care of at home. For them to be that sick that they're in the hospital in that volume, that was bad. And we're approaching that number here. I don't have the exact number from yesterday, but a couple of days ago, we were at 30. So data showing us that there's a surge of hospitalizations in other places. Kids under 5 that don't have a vaccine available are getting hit harder.
Okay. The next question we have is from the recent, the booster shots, first they have approved it for above 60, and then they went ahead and approved it above, FDA approved it for above 17 years old. And now we have recently seen after 12 to 15 years too. So how safe are the kids' vaccine? They're becoming shorter and shorter, and the span between approvals between adults and the kids is actually shorter than what it was for the initial COVID vaccine. So what are your thoughts, anyone from the team, what are your thoughts on this and how safe is it for the kids? And have they done enough trials to even lessen the duration and still think that it's safe for the kids?
I guess I'll take it. We're the health department, right? So we do kids vaccines all day, every day for many things. So first, let me acknowledge that these are new vaccines and we are all learning as we go. But I also want to assure everybody that all of the right steps are being followed. Some of the people who truly follow this were kind of frustrated that kids vaccine kept getting delayed because they had to keep extending their studies to gather more data, enroll more people so they could really know what the impact is. So that's why you're seeing some of these delayed approvals coming. Pfizer gets an approval, then several weeks later, Moderna gets an approval. And then the little kids vaccine got further delayed. I mean, the 5-year-olds were supposed to have a vaccine approval by now, the under 5, and it's delayed probably into mid next year because they want more study data. So a lot of those things are being done. The right steps are being followed. So the safety and efficacy of these vaccines is really not a question. They're working well. Have we found things that, studies didn't show? For example, we found that some of these vaccines in children were causing a heart inflammation. And that is now a recognized side effect. When you eat food, go to Chipotle and then you can get gas, right? I mean, that's a side effect. So same thing with these medications. And they've lowered the dose for kids. So kids 12 and older have a different dose, but the younger kids have a 1/3 dose. So they're doing a lot of these things to make sure the side effect profile is really, really low, and we still get the benefit of getting the vaccine. So I'm getting my kids vaccinated, and hopefully y'all are too, because the data that we're seeing is kids that are not vaccinated, we're sending them into a high-risk scenario because they're going into schools, they're going into daycares, and then schools are unable to require policies because of orders that you can't require masks and all this type of thing. So you're literally sending your kid out into a world that's full of people. Half of them are vaccinated, half are not. They have family scenarios that you can't control. So the best thing we can do is give our child the best protection we know is available, and that's the vaccine.
Thank you, Dr. Taneja. And now this question is for the whole panel. We have almost been 2 months short of 2 years in this pandemic, and it keeps evolving, it keeps changing. There are new variants coming up. So from your individual perspective, all three of y'all, what do y'all see in the near future? Do y'all see anything in something good coming out, or or we are going to continue like this for the next 2 to 3 years? Or we have a booster 2 and a booster 3 and a booster 4, something like that?
I can start.
Okay.
So obviously, you all are noticing it for yourself. With the Omicron variant, symptoms are much milder. People are recovering much faster. Whether that is related, whether that is a factor completely due to the virus changing itself, or because we are now more people are vaccinated, and there's more treatments available as well. So it's a combination of, I think, both factors. But in general, the variant Omicron is less severe and shorter duration. And we're seeing that even in unvaccinated population as well, actually. Now, where are we going to be going, in the future? I do believe that if you've not had an infection, say within the past 3 months or 4 months, then we've seen with the first 2 doses that about 9 months after your second dose, that your immunity is decreasing or waning off. That means that about 9 months after your second dose, now you're vulnerable to get COVID, more likely. That's why they had recommended, 6 to 9 months after your second dose, get your booster. Usually, as you go out farther, I think the interval between the doses is probably going to be stretched longer and longer, because now you've had 3 doses, you've had various degrees of immunity, and with the Omicron, it looks like this is just my educated guess, if you want to call it. About half of the population is going to be exposed to it. That's what it's looking like. So it's going to act like a booster, and it's probably, in my opinion, maybe a much better immunity because you're exposed to the entire virus and a variant than the vaccine might be. So all these factors are going to play in, and I see that, as we go further, our immune systems are going to be more and more better, and they're going to be able to handle the virus better. And right now, I think the deaths is about 850,000 or close to that. I'm assuming there's still going to be more deaths the rest of the year, but I think in a year, my guess is that we will be where it's like a cold or something, and we get over it in a few days. And that's my guess. If especially you've had vaccine and or disease.
Would you like to add?
Yeah, let me add some historical perspective. Public health folks, we study pandemics for a living, right? I mean, that's what we do. So a lot of these pandemics, they tend to last 2 to 4 years. Look at the big 1918 one, even though it was rough for just a couple of years, it actually stayed with us for another 2 more years. Is it going to happen with COVID? Nobody really knows. But all the indications are that it's not going to just like suddenly disappear. Most pandemics come in waves, multiple waves, right? And some of them are higher than the other ones. And then the latter half of that is smaller waves, milder waves occur. And then some pandemics disappear altogether. And it depends on the virus. And if you find a natural reservoir that easily retransmits things. And some of that depends on the public's cooperation in fighting off the pandemic. We have all the tools available. Why are these mutations coming out and the variants coming out? Because we've had a lack of cooperation among the world. Different countries don't have access to vaccine, and then people that do have access to vaccine are resisting. Tarrant County, for example, about 60% vaccinated, 40% are like, nah, I'm not going to take it. Well, those 40%, when they do get the virus, it becomes a replication factory. That's where mutations occur. And that's how you're finding these variants emerge over time, because virus mutates really fast, and then, oops, there's a mutation, and then it creates a new variant. So the short answer of all of this is that, yes, if we could, in theory, which is really hard, all work together and get everybody vaccinated, you can push the virus down to a level where it's almost not a problem. And we've seen that occur with other diseases, but it's taken years, sometimes decades to do that. But the pandemics do tend to burn out for various reasons, like Dr. Reddy mentioned. Half the population gets the illness, so they've got some natural immunity. The other half gets vaccinated, so they've got some immunity that way. And then the mutations tend to sometimes weaken the virus itself. Omicron is a perfect example. It's more infectious, but seemingly a little bit lighter on, causing severe illness. So can other mutations occur? There's a new mutant out in France right now called the IHU, and it's supposed to be as similar to Delta, but it's staying pretty slow in terms of spread. So who knows? It may eventually mutate into something that doesn't really cause us much of an issue. But, when the surge is on, so let me give you one quick example. We had a cold snap over the last couple of days. Did you all just keep going out in shorts and t-shirts? Like nothing's changed? No, you layered your protections. You put on jeans, sweatshirts, jackets, hats, gloves, all of that stuff, right? Because there's a cold snap. Well, now there's a huge wave of a pandemic. There's a lot of cases. Well, layer your protections, get your vaccination, get your booster, get your mask on, avoid large crowds. And then once this wave subsides, we can take some of those layers off. And that's how you continue to fight the pandemic. And eventually, there will be enough people with the vaccine and natural immunity from illness, and we'll have more treatment options widely available. It will become very manageable. The goal was early on to get rid of this, but now it looks like it's probably going to stay with us for a while, just like the flu does, and we'll just have to manage it, right? And it will become manageable. It will become less of a problem where all these pandemic level measures don't have to be in place, but it may take a little while. Nobody really knows. But the best guess is, at least in 2022, maybe towards the end, we're going to start to see some tapering off and some milder, scenarios start to occur. It remains to be seen if that truly holds or not, but that's what most of us are hoping for.
I think from the hospital side, I would just add on is that 2 years ago, our world's changed drastically in how we provide the care to all of our patients. And If you told me 3 years ago that we would allow a lot of folks to work from home that were working in the hospital, be like, oh, that's never going to happen. And now we do, right? So we're in that same surge again, where we say, if you don't need to be here at the hospital, if you can work remote, work remote. The only thing I'd also add is that, if you have that opportunity to not have a face-to-face meeting with somebody and you can do it via Zoom like this, absolutely. If somebody's coming into your office, even if everybody's vaccinated, wear a mask. That's kind of what I've been doing with our team here at Southlake, is just to ensure our leaders or our staff, we can reduce that possibility of catching the virus, just because we're in healthcare. We don't get to shut down and say, hey, sorry that everybody in the hospital's got COVID, so we're closing our doors. We need to be there for the community, for, as we mentioned earlier, the heart attacks, the strokes, everything else that's going on. We need to be there for you all. And so I think in the next coming months, I think we'll continue what we've done over the last 2 years as far as our visiting policies and our masking in within the hospital. Our community is definitely one that when somebody's in the hospital, we want to go see them and see how they're doing. And no, don't do that. If they're in let the healthcare professionals take care of them, and you can visit them when they're out. That's a big deal for us to make sure we can reduce the traffic in the hospitals that don't need to be there, right? So as others mentioned, we're probably in this for a little bit longer. And one thing is we're living out history right now. One day our kids and our kids' kids will be reading about the big COVID and like, what was that? And in our old age, we'd be like, oh yeah, that was a time we all started wearing masks. And so just be cognizant of your surroundings, be thankful for the leadership that we have with science, right? And so how quickly we got the vaccines and everything else that's going on, and be patient, right? So this has never been around. And so it's an honor to be part of a healthcare system and in a healthcare industry on how quickly we've moved to get these vaccines, to get the vaccines for kids. And yes, there's probably some frustrations as far as why don't we have it yet for the 5-year-olds, but it takes time. It's for safety, and it's not political. It's just making sure we're all doing our part to make sure we're rolling something out to our population that's safe. And so I think patience is going to be a key thing for all of us, and spend time with your family like no other. And so now may be the good time for the kids to get on the devices, right? So don't go play with others. But that's where we need to just think about our family unit and stay strong with that, and think about all those that are immunocompromised, that are older. Just make sure the generations are here and we don't succumb to this disease just by not thinking things through.
Thank you very much. These were really wonderful. This was a wonderful discussion overall, and I really appreciate all the questions we got through from all the different channels. And since we just are 5 minutes away from closing this webinar, I would like to first thank Benson, Dr. Reddy, and Dr. Taneja for being here and working with Southlake Foundation. And thank you, Southlake Foundation, for giving us this platform to discuss about the concerns and issues. And I have one announcement to make. We have a free drive-through RT-PCR test that's happening right now. And please call 682-274-4350 for more information. And be in the end, being a mom, every person in Southlake is a concerned mom right now. The last 4 minutes, I just want to spend on giving your advice or something for school children, from they could be elementary, middle school, or high school, doesn't matter. Because every mom is a concerned mom right now in Southlake. So what are your advice?
Well, let me go first, because what I'm about to tell you is the only real way out of this pandemic. Vaccinate, vaccinate, vaccinate. If your child is eligible for the vaccine, let's get that child vaccinated. Other things you do not control. I don't control what policies state and local governments make. We do not control that. We in the medical community understand how important it is to wear a mask when you're around others, and keeping sick children at home. Not everybody understands that, and not everybody's in a situation to do it. Imagine there's parents who need the paycheck, right? They have to go to work and their child got a little cough and a cold. Well, go to school, no problem. Well, they didn't know the child had COVID. And now there's 30 other kids in the classroom that are exposed, the teacher's exposed. So that's life reality. It's going to happen. Now, get your child vaccinated because that's protection they carry with them all day, right? That's one layer of protection. Second is teach your child how to wear a mask properly. No hanging around under the chin, or on the side of the ear or in your hand all day. If you can, wear a mask. Yes, it's going to have to come off during recess time and at lunchtime and all those type of things. But you can teach your child how to properly space from other children while they're doing these activities. It's going to be really, really hard, but you can talk to them. Those are the two main things. In a school setting, social distancing is going to be really hard, but those two main things are going to be the protections that your child really needs to learn. And that should carry everywhere. School is a high-risk environment because you got a lot of kids together. But when you come home, that's where we see a lot of exposures occur because they're playing with other kids with the neighborhood, or they've gone to a store or a Christmas party, a birthday party, and then they relax, right? Oh, I'm here for a party. No, all these protections need to stay on. And some of those things, if you can avoid, my kids haven't had a birthday party. We did it with immediate family, and they sat out in the garage, with the heaters blowing and everything, right? Where the airflow was there. We did that, but not I didn't have like a whole neighborhood over because we just don't know who's got what, right? So we're going to have to wait it out a little bit to get back to those normal routines. But that's where some of the parental advice is coming. Let's get your children protected so we don't see them in the hospital. We really don't want to see a child severely in the hospital. This is very, very preventable illness. That will be a failure on all of us if our kids are in the hospital.
Anything you would like to add, Benson and Dr. Reddy, to our school-going children?
I would just add on is, education, right? So it's educating our kids on the why. You wouldn't throw your child into a pool without educating them and training them how to swim. And so I think that a lot of our kids have to understand the why we're asking them to mask, why do hand hygiene? Because if they've got to truly buy into it. And kids are always watching what we do as parents. And so if we're not doing it, then you can't do as I say and not do as I do. So that's going to be key because our kids are watching us. And when we first told our kids and we got our COVID positive test, our kids' eyes were like, oh my goodness, because we had been educating them on why we don't want to get COVID. And the scared look on their face, I was like, calm down. It's okay. You see mom and daddy, we're fine. We're not, we have mild symptoms. And it just hits it home, right? So I think as parents, this is not a clinical advice. This is a parental advice, right? We have to show, our actions have to speak louder than our words. And so the best thing you can do for your kids, as Dr. Danae has mentioned, was get vaccinated and then do as what you're asking them to do and be a good example.
Yeah, I agree with, both Winnie and Benson, what they've said. And also in addition, there's probably a, close to 50% chance, just given the circumstances at school right now. And, even though you're vaccinated, there's probably about a 50% chance that, our kids are going to catch it. I'm not giving you an exact number, 50%, but at least, 30% or something like that. So just be prepared for that, and, learn what to do if they get it and, where to go, and just have a backup plan in terms of, who's going to be taking care of them and things like that. I think that's the only other thing that I can add, that, there is a, fair possibility that, one of them could catch it, just because at school, it is spreading a lot right now. Yeah. Thank you.
Thank you very much. To conclude, from what's the message for school-going children? I like how Dr. Taneja said, layer up. Just how do you layer up? Like when it's cold, just layer up with vaccines and whatever it requires. And even kids can take the vaccine, and please do not challenge science. And like how Benson said, like, educate the kids, like educate them with what COVID is and what it means and what they need to do to protect themselves. And lastly, like how Dr. Reddy mentioned, like, it's going to come, like, but be prepared for that and learn from your surroundings. Thank you so much, South Lake Foundation and our esteemed panelists here. Really appreciate for taking the time to be with us, and also like all the guests who have joined and participants for questions and like for anything that we have left out or something, feel free still to contact us and reach us. And I think in a few hours or a few days from now, we would also post the recording session so that you would still be able to catch up if any one of you all missed out. Thank you very much.
Thank you.
Thank you, Benson. Thank you, Dr. Reddy. Thank you,
It's
Dr.
been a pleasure.
Thank you guys for hosting.
Thank you.